A final word on the lockdown exit strategy is awaited from the centre, even as states like Odisha and Punjab have already extended the lockdown in their states till May the 1st. COVID-19 hotspots identified across the country will likely remain under lockdown. However, whether some industries will be permitted to run with half the workforce is a point on which clarity is yet to be conveyed. COVID-19 cases in India have crossed 7,000 with 239 deaths reported. India witnessed the highest number of fresh cases since the outbreak began here. 1,000 new cases were reported in 24 hours. The Indian Health Ministry still maintains that there is no community spread in the country, only cluster outbreaks. Migrant workers in Gujarat's Surat went on a rampage Friday, demanding they be allowed to go home amid the lockdown. They resorted to violence, allegedly fearing an extension of the lockdown. Police have detained 60 to 70 people. The Indian industry has a plan for resumption of economic activity through pooled testing. By this method, a group of workers' nose and throat swabs can be taken using specified procedures in a buffer solution, which can then be tested for COVID-19. This will reduce the need for individual testing amid the shortage of kits. If the batch of combined samples tests negative, then the group can be permitted to work. In case of a positive result, individuals' testing would be done. The positive sample can then be identified in 4 to 12 hours. The Indian Council of Medical Research has written to 13 medical institutions of eminence across the country to act as mentors in the process of increasing testing for COVID-19 in states. These institutions are expected to serve as mentors of the medical colleges in their catchment areas and facilitate the establishment of COVID-19 testing facilities in their respective states. France reported 43 cases of heart incidents linked to treating coronavirus patients with hydroxychloroquine, the malaria drug US President Donald Trump has repeatedly touted as a potential game changer. Meanwhile, many countries have placed an order for this drug from India, and the government is set to ship the quote-unquote essential drug to 13 countries in the first consignment.